I'm Spotlight on America correspondent Angie Moreski. We're here in Atlanta following the battle of a community against an invisible cancer-causing gas. For years, Spotlight on America has investigated the potential health impact of ethylene oxide, used to sterilize medical equipment at facilities like this. New, tougher emissions regulations set to take effect next year were supposed to help, but now presidential exemptions are leaving communities like this in limbo. In a small town, just about 45 minutes from Atlanta,
Gosh, what a nice breeze. Don't you love a porch?
known for its southern charm and beautiful country homes, Covington, Georgia is an idyllic American town, but it's also battling a toxic legacy in the air. People here say they've been breathing a cancer-causing gas for decades and blame a medical sterilization facility in town for poisoning them.
Lisa Baker, and I had breast cancer. Shannon Buff, and I have breast cancer also.
Connie Waller, and I had breast cancer.
David Waller, and I had lymphoma and throat cancer.
These longtime Covington residents say cancer in their small town is unusually common, especially early in life. When they told you, how old were you?
It was actually my birthday, so I was 34, and technically, I guess 35 because I found out on my birthday.
Lisa Baker was one of 6 moms with cancer, all diagnosed within a few years when their kids were at the same school, including Shannon Buff, who was 38 when she found out. You were worried you were going to die.
I was terrified that I was going to die.
This is really ground zero for Covington's biggest nightmare.
Covington attorney Michael Joffroy points to ethylene oxide emissions at this BD-barred medical sterilization plant in the center of town as a common link.
A neighborhood on either side of us right here, people living their lives, growing up right here next to somebody with toxic, dangerous chemicals that went unchecked for decades.
Joffroy is on a team of lawyers representing cancer patients suing BD, including a landmark case representing local trucker Gary Walker. A jury awarded him $20 million this past May. A verdict on punitive damages is yet to be decided. BD Bard has operated in Covington for more than 50 years. It's one of more than 100 facilities nationwide that use ethylene oxide, or ETO, to sterilize more than 20 billion pieces of medical equipment a year, half of all sold in the U.S. The colorless, odorless gas was classified as a human carcinogen by the EPA in 2016, with the agency saying it is 30 times more toxic to adults and 60 times more toxic to children than originally thought, and can pose long-term health risks to nearby communities. Studies show ETO has been linked to leukemia, non-Hodgkin's lymphoma, and breast cancer. This baseball field is right in the middle of Covington. For decades, it's been a central gathering spot for the families who live in this small town, and now it's at the center of concern for so many who've had cancer. The BD plant is just 1/10 of a mile away, right through those trees. You spent a lot of time on that field.
Oh,
We
a lot
spent
of
a lot of time
yeah.
on that field, practicing, playing.
Yeah.
My son played ball in the ball field across from the plant.
Knowing my kids have been around this, it's just makes me sick to my stomach.
Constant exposure.
Did any of you realize the risk?
Not in
never.
the least.
Not at all.
It wasn't until 2018 that the risk of ETO began to emerge publicly. That year, federal data revealed Covington was among about 100 census tracts nationwide with a higher cancer risk, due in large part to ethylene oxide.
The judge granted our motion.
Now, these residents are among more than 100 cancer patients represented by Joffroy suing BD. BD would not do an interview with Spotlight, but told us in a statement the company is committed to the safe and responsible operation of its facilities and has made significant investments to upgrade emission controls.
I want people to be held accountable.
But residents like Shannon say they feel blindsided because they were not warned about the risk, and they are not alone in their anger.
We were breathing a deadly
carcinogen.
For the past 5 years, Spotlight has traveled around the country, documenting community concerns about ETO emissions. From Willowbrook, Illinois, where citizen protests led to the closure of the Sterigenics medical sterilization facility here,
We are sick and we are dying.
to Louisiana, where minority communities were disproportionately being impacted. Vernon, California, where one plant sat just a few thousand feet away from a school.
My feelings were anger.
And Laredo, Texas, where Maria Salazar's son Manny was one of several students suffering from cancer in the same high school at the same time. He lost his fight.
It breaks you.
Nationwide, more than 14 million Americans live within 5 miles of facilities that emit ETO. The vast exposure to citizens prompted the Environmental Protection Agency to take action in 2024, approving new federal rules to drastically reduce ETO emissions by 90%. But less than a year later,
today I'm pleased to make the largest deregulatory announcement in U.S. history.
the new head of the EPA, Lee Zeldin, announced the agency would reconsider the tougher ETO emissions regulation, along with a list of more than 30 other clean air rules. And the White House announced companies could email the administration to ask for 2-year exemptions from compliance deadlines. We wanted to know which companies were asking for exemptions and on what basis. So Spotlight on America submitted a public records request to the EPA. It took months, but we obtained more than 800 emails, giving us a glimpse into why the industry said they wanted the exemptions. Many companies argued it was technically infeasible to meet the compliance deadline.
Of these facilities, 7 appear to already meet the emission standard.
But senior attorney at Earth Justice Marvin Brown says several facilities have already installed the very equipment needed to reduce emissions. So they're already doing it.
They're already doing it. EPA knows it can be done because there are 7 facilities that are doing it today.
In July, President Trump announced exemptions were granted to nearly half of all commercial sterilizers nationwide, echoing industry arguments and citing a provision of the Clean Air Act which allows exemptions based on lack of available technology and national security interest.
Is this unprecedented?
Incredibly unprecedented. This provision has never been used before to exempt so many facilities all across the country from complying with public health rules and regulations.
It all comes at a time when Spotlight on America discovered levels of ETO in the air could be much higher than previously reported.
So this is our mobile observatory measuring particles and other pollutants, otherwise known as Mom and Pop.
Johns Hopkins professor Peter DiCarlo is a leading scientist doing first-of-its-kind real-time testing of ETO in communities like Louisiana's so-called Cancer Alley.
For ethylene oxide, we saw concentrations of 30 parts per billion.
Which translates to?
Don't breathe that.
DiCarlo and his research partner, Professor Keeve Nachman, told Spotlight, recent testing shows ETO levels are even worse than government models predicted.
This spike reflects when we drove past the facility, we saw the level of ethylene oxide go up.
It leaves them worried about 2-year exemptions and a possible rollback of the ETO regulation being reconsidered.
All the time we're spending debating extensions or delaying the implementation of this rule, people are still breathing polluted air. They're still at risk. It's continuing.
What are the costs to the community?
And the costs to the community are people's lives being shortened by cancer.
Back in Covington, BD Bard is one of the companies that got the 2-year exemption, telling Spotlight it will ensure adequate time to, among other things, design, install, and test the equipment without disrupting the supply of critical medical devices.
No one is going to take away from the importance of medical products or the medical industry, and sterilization included in that. But you can't prioritize those lives over the lives of people who live right down the street from your factory.
What do you want to see happen?
I want to see ETO out of our neighborhoods. There's no reason to put a plant like BD a half a mile from your hospital and your courthouse and your schools.
Geoffroy's clients are prominent local citizens, a local business owner, Georgia's 2024 Principal of the Year, longtime past director of Keep Newton Beautiful, and retired director of Georgia's Department of Natural Resources Wildlife Division. They say they hope, as community leaders, their message is heard.
We matter. I'm not a statistic. I'm a person with 2 beautiful children that lives in a beautiful community that just wants the opportunity to breathe. That's it.
In our 5 years of reporting on ethylene oxide, no sterilizer company or group that represents them has agreed to do an interview with Spotlight. The EPA and White House won't either. You can read the full statements they provided on our website and see more of our years-long investigation into ETO. Just go to spotlightinvestigates.com. For Spotlight on America, I'm Angie Moreski.